This recorded review will be for Foundations 2, Exam 3. This will go over chapters 29 through 32 in the Fundamentals textbook. All right, chapter 29. What amount of urine output reflects adequate kidney perfusion? So for this, we're going to look on page 552. It's going to be in the bolded text. There should be at least an hourly urine output of 30 mLs. This reflects adequate kidney perfusion. What are some strategies the nurse can suggest preventing recurrent cystitis and urinary tract infections? So for this, we can look on page 553, and you can see this in the green health promotion box, how to prevent recurrent cystitis. It would be important to pay attention to, for the female patient, avoid wearing tight clothing and nylon pantyhose that cause continual perineal moisture. Instead, wear cotton underwear. What is a common first symptom of a UTI in the older adult? So we're also going to stay on page 553 for this one, and you're going to look in the green box of lifespan considerations. Your older adult patient may develop an infection and not manifest a fever. In fact, the temperature may be lower than normal. Subtle changes in mental status might be the first symptom of an infection, so monitor your older adult patient closely for any changes in alertness and orientation. Any disorientation or confusion could be the first symptoms of a urinary tract infection in your older adult patient. How soon should a urine specimen be sent to the lab after collection to preserve the chemical properties of the urine? So we're going to find this information on page 554. If the specimen is to go to the laboratory, transfer it to the specimen container and label it properly. Then send it to the laboratory within 5 to 10 minutes. Urine that stands for 15 minutes or more will change characteristics, and the urinalysis will then not be accurate. How would the nurse instruct a patient who is to perform a 24-hour urine collection? So we're going to look on page 555 for this, under 24-hour urine specimen. The patient's bladder should be empty at the beginning and at the conclusion of the test. The patient empties the bladder just before beginning the collection, and that urine is discarded. At the ending time, the patient voids, and then that urine is added to the collection container. What is one non-invasive method that the nurse could use to collect urine from an infant? I feel like this is personally a slightly controversial method because it can allow some bacteria to get on the skin, but it is a great non-invasive method. So on page 556 on urinary collection bag, this device is used to obtain a urine specimen from an infant or toddler. The skin is cleaned, and then the device is attached to the skin by an adhesive backing. It is then placed so that it surrounds the genitalia. When sufficient urine has collected in the bag for a specimen, the bag is removed and the urine is poured into a specimen container. When caring for a patient with urolithiasis or nephrolithiasis, that's going to be bladder and kidney stones, what should you include in their toileting routine? So with this, we're going to look also on page 556 under strained specimen. If the patient is suspected of having a urinary stone, all urine is strained when voided. Usually a fine sieve is used. If a stone is found, it should be saved and sent to the laboratory for analysis. What is a toileting intervention the nurse could suggest to the patient who states they feel too weak to walk to the bathroom? So for this information, we're going to look on page 557 and also 559. Assisting patients with urinary elimination is a basic nursing function. Patients who can ambulate can be assisted to the bathroom to use the toilet. Others may use a commode chair for bowel or bladder elimination. It is usually placed by the bedside or a short distance away. The patient is transferred from the bed to the commode and then back again. The receptacle should be emptied after each use. A patient who is too weak to walk to the bathroom might be able to use a bedside commode safely. Page 559. After placing a patient on a bedpan, what position should the nurse leave the patient in? We can find this information on page 560. It's going to be within scale 29.1, placing and removing a bedpan. Look at number 8. Raise the head of the bed to 30 degrees if not contraindicated. What are some strategies to initiate the voiding reflex? We can find this information on page 561 under helping a patient urinate. All efforts are made to help the patient void naturally before resorting to any catheterization. Some methods of helping patient initiate the voiding reflex are, and they are listed on page 561. My favorite is to run water in a nearby sink so that the patient hears the sound. What is the average size catheter used for the adult male and female? For this information, we're going to look on page 562. Catheters come in several sizes and shapes and are either rubber or plastic. Some are Teflon coated. They are sized using the French system, with the average size used for an adult woman being 14 to 16 French, and for an adult man being 18 to 20 French. The nurse anticipates that the patient who is post-op from prostate surgery will have what type of catheter? We can also find that information on page 562. The Alcock catheter, used for continuous bladder irrigation following prostate or bladder surgery, is a Foley type catheter with 2 drainage eyes. What is the appropriate technique to apply a condom catheter? Well, for this, we're going to look in skill 29.2, applying a condom catheter, and we're going to look at number 11. Grasp the penis along the shaft with the non-dominant hand. Hold the condom sheath at the tip of the penis and smoothly roll the sheath onto the penis, leaving 1 to 2 inches of space between the tip of the penis and the drainage tube of the condom sheath. Position the condom catheter on the penis and allow free passage of urine into the collecting tube and drainage bag. Keep the penis away from the collecting urine. What is the order to use when cleaning the vagina prior to inserting a urinary catheter? So for this, we're going to find the information in skill 29.3, catheterizing the female patient, and we're going to look at number 24. Using forceps, pick up one saturated cotton ball at a time and cleanse down one side of the labia majora and then the other, discarding each used cotton ball after one stroke. Cleanse one side of the labia minora and then the other. Cleanse last over the meatus with a slow downward stroke. Do not allow the labia to close over the meatus after cleansing. This removes microorganisms from the perineal area and the urinary meatus. Do not pass over the sterile field with a used cotton ball when discarding them, because this will contaminate the sterile field. That's very important. What would the nurse do if resistance is met when inserting a urinary catheter in a male patient? So for this information, we're going to look in skill 29.4, catheterizing the male patient, and we're going to look at number 17. If resistance is met, pause and ask the patient to take a deep breath. Then try to twist the catheter or instruct the patient to turn feet soles inward and wiggle their toes to relax the muscles. If resistance persists and the catheter will not advance without difficulty, remove it and then notify the primary care provider. The internal sphincter will relax with a deep breath, but forcing the catheter against resistance can cause trauma. How often should the nurse monitor the patient's urinary output after catheter removal? So for that information, we're going to look on page 572 in the QSIN considerations, right underneath the QSIN considerations. If the facility does not use the automatic stop order system, it's the nurse's responsibility to obtain an order for removal as needed. The patient is kept on intake and output recording for 12 to 24 hours after catheter removal to ensure that the bladder is draining adequately. Page 572. How would a nurse educate a patient on performing self-catheterization? So for this, we're going to look on page 573, self-catheterization. under patient education, the blue box. It's important to perform hand hygiene. It would be important to cleanse the urinary meatus with a soapy washcloth or a towelette, then rinse it with a wet washcloth and pat it dry. If the patient is female, she should hold the inner labia open and stroke down and back to prevent any fecal contamination of the meatus. The female can locate the meatus by touch and place the index finger of their non-dominant hand on the clitoris. Then place their third and fourth fingers at the vaginal opening and locate the meatus between the index and third fingers. For the male patient, they should lift the penis to a 60 to 90 degree angle and straighten the urethra before inserting the catheter. With the drainage end over a basin or a toilet, insert the catheter into the meatus. For the female, they should direct the angle toward their umbilicus. It's important to twist the catheter as you advance it. If any resistance is met, take a deep breath while trying to advance the catheter. Hold the catheter in place until all of the urine stops draining. Then pinch and withdraw the catheter slowly. Most catheters are intended for single use, so dispose of the catheter in an appropriate receptacle when finished. Page 573. When irrigating the bladder, how much solution will the nurse draw up for each irrigation attempt? We can find that information within skill 29.5, performing intermittent bladder irrigation and installation, and we're going to look at number 17. Draw up 30 to 40 mL of solution into the syringe while maintaining sterility. Expel air and attach the syringe to a sterile insertion connector. For irrigation of the adult bladder, 30 to 40 mL is acceptable. Injecting air into the bladder will cause discomfort. When irrigating the bladder, after instilling the solution, what is the next immediate step? So for that, you're going to look at number 19. After you expel the air and attach your syringe to the sterile insertion connector, you are going to attach the sterile insertion connector to the port and then instill the solution. For irrigation, you need to immediately unclamp the tubing and lower the catheter so that the fluid runs into the drainage tubing. This irrigating fluid and debris will irrigate fluid and debris that clog the catheter and need to flow out. How would the nurse educate the patient to perform Kegel exercises? So that information we can find on page 578 in the patient education box. Pelvic muscle Kegel exercises to correct incontinence. Teach your patient to concentrate on stopping the flow of urine when voiding by tightening their pelvic muscles. If you cannot identify the correct muscles in this way, place a finger inside your vagina if female or rectum and try to squeeze around the finger. These are the same muscles that you will use to keep from expelling gas or a bowel movement. If you are contracting your abdominal muscles, you are doing the exercise incorrectly, and do not hold your breath while contracting and holding. Moving on to chapter 30, promoting bowel elimination. Describe occult blood. We can find that on page 584. Occult or hidden is old blood. This is suspected when the stool changes from a normal brown appearance to a dark black color with a sticky appearance. Describe steatorrhea. We can also find that on page 584. Stools with an abnormally high fat content are known as steatorrhea. These are usually foul-smelling and will float on water. They also will appear frothy. What are some factors that predispose the patient to constipation? We can find this information on page 585. Nurses must be aware of any potential of illness-induced constipation. Any patient restricted to bed rest is at risk for constipation. Many medications, barium X-ray studies, or recovery from surgery can also contribute to constipation. Patients at risk for constipation should be identified early. When taking Metamucil, what should the patient also be doing to reduce the risk of fecal impaction? We can find this information on page 586 in the lifespan considerations for the older adult. Products such as Metamucil and Benefiber are readily available without prescription. A large amount of fluid should be taken with these products to prevent constipation and fecal impaction. The rectum and sigmoid colon would become filled with hardened fecal material in fecal impaction. And that's page 586. What are some medications that can be used to stop diarrhea? So for that, we're going to look on page 586 as well, in box 30.2, common medications used for constipation or diarrhea. And you're going to want to look all the way down at the bottom, medications used for diarrhea, antidiarrheals. And loperamide hydrochloride is also known as Imodium. That's a very common one. For the older adult with diarrhea, what might be a better fluid replacement than water? We can find this information on also page 586 in the lifespan considerations for the older adult. Older adults become dehydrated more quickly than younger adults. Observe closely for signs of dehydration and fluid imbalance when diarrhea occurs. Commercial beverages such as Gatorade contain sodium and potassium, should be taken in small amounts at a time. This will help replace electrolytes if the patient has continuing diarrhea. Evidence-based practice indicates the consumption of caffeinated tea, coffee, or soft drinks will further contribute to dehydration. If the person becomes confused and dehydrated, a trip to the emergency department for fluid replacement might be necessary. Distinguish between normal and abnormal assessment findings for the abdomen and bowel. So for this, you're going to want to look on page 587 under physical assessment in the purple focused assessment box. Observe the shape of the abdomen with the patient supine. Auscultate for bowel sounds in all 4 quadrants. Percuss for the presence of excessive air or gas in the bowel. Gently palpate for masses or tenderness in all 4 quadrants. A normal abdomen is non-distended, soft, with active bowel sounds in all 4 quadrants. If the patient has not defecated in blank days, interventions need to be taken to assist with elimination. So we can find that information on page 589 in the bolded text. When the average patient has not experienced bowel evacuation within 3 days, measures should be taken to assist with elimination. Page 589. What should the nurse prepare for after a patient has had a barium X-ray? We're also going to look on page 589 for that. Measures to rid the bowel of barium are essential after a patient has had a barium X-ray examination. Encourage an increase in fluid intake of 3,500 mL per day for the next 24 hours unless contraindicated. A laxative is often recommended. After how many days of using antidiarrheal medications should the patient contact a doctor for further evaluation and treatment? We can find this information on page 589 in the bolded text. Observe for signs of dehydration when the patient has severe diarrhea, decreased skin turgor, dry mucous membranes with thick saliva, and increased thirst. Self-medication for diarrhea should not continue for more than 48 hours without consulting a primary care doctor. What types of cleansing enemas are there, and how much fluid should the nurse put in the enema bag? Just going back to the normal and abnormal assessments for the abdomen and bowel, I want to bring you back to page 587. Be sure to take a look at the purple clinical cues box to place the patient in a supine position. Auscultate for bowel sounds in all 4 quadrants. Absent or few bowel sounds would indicate decreased motility and potential for constipation. This can also signal an abnormal bowel blockage. Active bowel sounds are associated with increased motility that occurs after eating. Loud hyperactive sounds can be called bororygmy, can occur with diarrhea. Distension is revealed by an abdomen that is rounder and tighter in appearance than normal. The patient's abdomen is assessed for distension by percussion, and the nurse gently palpates the four quadrants of the abdomen to check for any tenderness and masses. And that's on 587. So cleansing enemas and how much should you put in the bag? So on that one, we're going to look on page 590. We're going to look in table 30.1, types of enemas and their actions. Look at the cleansing enema. It can be a soap sud enema. This would be 5 ml of Castile soap in 1,000 ml of water. It could be a tap water cleansing enema, or it could be a saline cleansing enema. For a saline cleansing enema, you would want to use 500 to 1,000 ml of normal saline. When administering a cleansing enema, how long should you instruct the patient to hold the solution? So we can find this information on page 5. For this one, we're going to want to look under actually retention enema. And it'd be important to note that the oil needs to be retained in the rectum to soften and coat the hardened feces. And the oil should be retained for at least 20 minutes. And you would want to do the same for a cleansing enema, at least 20 minutes. What temperature should an enema be? So for this, we're going to want to look on page 591 under the Cusin considerations, safety, not too hot and not too cold. The temperature of the enema solution should be about 105 degrees Fahrenheit. If a bath thermometer is not available, test the temperature of the fluid by pouring a small amount over the inner wrist. It should be warm to the touch but not hot. Solution that is too cool usually cannot be retained, and hot solutions can damage the tissues of the rectum. After administering blank enemas for the purpose of clearing the bowel, the nurse should contact the ordering physician. So for this one, we're going to look again on page 591 under Cusin considerations for safety. Be careful with the enemas until clear order. When an order to give enemas until clear is written, it means that the return fluid must not have any fecal matter in it. However, no more than 3 large volume enemas are given without checking with the primary care provider, because repeated enemas can deplete electrolytes, and this can be very dangerous. So after administering 3 enemas, you would want to contact the physician. What is a risk when performing digital removal of a fecal impaction, and when would the nurse stop the procedure? We can find this information on page 593. Digital removal of a fecal impaction must be done gently, and the patient needs to be watched for any signs of a vagal response from stimulation of the sphincter and rectal walls. The vagal response can cause a slow pulse and cardiac arrhythmia, and an alteration in blood pressure can develop. Should this occur, immediately stop the procedure. Place the patient in a supine position, monitor their vital signs, and notify the primary care provider. A dose of atropine might be ordered to counteract this vagal response. What is a bowel retraining program and what is not included in it? We can find this information on page 594. A bowel training program is based on the principles for establishing a regular bowel elimination, adequate diet, sufficient fluids, adequate exercise, and sufficient rest. A regular time for evacuation should be established. A reasonable goal is to achieve defecation within 1 hour of the established time. Factors that help establish the time will include the patient's prior bowel habits or the nurse's observation of when the incontinent movements tend to occur. Many bowel retraining programs are timed around a triggering meal when gastrocolic reflexes are the strongest, most commonly at breakfast. In most cases, stronger laxatives and enemas are not considered part of a bowel retraining program. When catheterizing an ileostomy internal reservoir, what should the nurse do when the catheter meets resistance? So we can find this information on page 597 and under steps 30.2, catheterizing a continent ileostomy. And you're going to look at number 4. Place the distal end of the catheter into the waste drainage container or the toilet. Slowly insert the catheter through the nipple valve and into the internal reservoir until the stool begins to drain. When the catheter meets resistance of the internal valve, ask the patient to take a deep breath and apply gentle pressure to open the valve. That's page 597. When changing an ostomy appliance and cutting the faceplate, how much larger should the opening be than the stoma of a colostomy, a urostomy? So for a ostomy, we're going to look on scale 30.2, changing an ostomy appliance, on page 599. Look at number 3. Measure the stoma with the stoma measuring device. Prepare the skin barrier or pouch with the faceplate by cutting an opening in the center approximately 1/8 inch for a urostomy and 1/4 inch for a colostomy, larger than the stoma. Then smooth the cut edges with your finger to prevent any irritation or leakage around the stoma. If the opening is too small, there might be irritation or restricted blood flow. When should the ostomy bag be emptied? We're going to look on page 598 for this. It is best to empty stool from the pouch when it becomes 1/3 to 1/2 full so that the weight of the effluent does not pull the appliance loose. What are some foods the nurse could suggest to the patient with an ostomy who is looking to decrease the odor of his stool? For this, we can look on page 596 under patient education, the dietary guidelines for the ostomy patient. And you're going to want to look at the foods that can decrease stool odor. Those would include parsley, beet greens, buttermilk, and yogurt. Chapter 31, Pain, Comfort, and Sleep. During which stage of sleep do we receive the most rest? For this information, we're going to look on page 620. NREM sleep is believed to be the time when the body receives the most rest. During this stage, heart rate, blood pressure, and respirations will decline. What type of pain would you expect to assess in the patient with severe arthritis? You're going to flip all the way back to the beginning of the chapter on page 606. Chronic pain is associated with ongoing conditions such as arthritis and back problems. When assisting the patient in using a transcutaneous electrical nerve stimulation unit, or TENS, what would the nurse do prior to placing the pads on the patient's skin? So for this, you're going to want to look on page 612 in skill 31.1, operating a transcutaneous electrical nerve stimulation unit. You're going to want to look at number 6. Spread conductive jelly on the electrode pads if the electrodes are not pre-coated. This provides for correct electrical conduction. How do binders reduce pain? Go back to page 611. Binders are cloths wrapped around a limb or body part. They are effective in relieving pain associated with strains, sprains, and surgical incisions. They support the surface and internal tissues during movement, coughing, and other activities. Which patients may be at risk of injury from heating packs? For this, we're going to look on page 612. Remember that the very young and very old patients have skin that is more sensitive to heat damage. In addition, patients with altered levels of consciousness, impaired movement and feeling, or poor circulation may not be aware when something is too hot. These patients can suffer severe burns in a short period. All patients should be closely monitored if any heat application is being used. What are some safety considerations the nurse needs to adhere to when giving a patient a cold compress? We're going to look on page 613 for this. Cold is most frequently applied in the form of cold or iced compresses. Some patients have a poor tolerance for cold treatment, so be alert to the patient's response when using cold applications. Occasionally, patients will have an increase rather than a decrease in pain when ice is applied. To prevent any skin damage, ice should be in contact with the skin for only a few minutes at a time, under the direct supervision of a nurse. Ice packs should be applied with a towel or other barrier between the pack and the skin and should not be left in place for more than 15 to 20 minutes. If a patient complains of cold with ice application, remove the ice and discontinue any further treatments. Explain to the patient that not all people are relieved by cold application to pain. Page 613. How would the nurse instruct the patient to engage in relaxation as a relief from pain? So we're also going to be on page 613 for this. Relaxation is a physical technique that involves conscious relaxation of muscle groups. Before beginning, make the patient comfortable in a quiet, darkened environment. Instruct the patient to first tighten and then release the muscles. Initially, encourage the patient to pay close attention to the difference in feeling of tension versus relaxation. What should the nurse do if the patient complains of pain with ice pack application? Is this normal? So yes, I kind of already gave you that answer, but occasionally patients have an increase rather than a decreased response to pain when ice is applied. If a patient complains of cold with ice application, you should remove the ice and discontinue any further treatments. Explain to them that not all patients will be relieved by cold application to pain. Again, page 613 for that. How would the nurse assist the patient in controlling pain with guided imagery? So for this, we're going to look on page 614 in the Patient Education blue box, Pain Control through Guided Imagery. Preparation. First, we assist the patient to a comfortable position. We lower the lights and eliminate any distractions. Close the door and post a note asking not to be disturbed. Now it's time to read the imagery script. Read slowly in a soft but easily heard voice. Pause frequently to allow the patient to form mental images. The script can be changed to incorporate a place or sensations that are specific to that patient. The imagery script is provided, and after the imagery experience, you need to allow the patient to share with you if that's desired, and also accept that some patients will not want to share. Page 614. Who is responsible for programming a PCA pump? We're going to find that information on page 617. The pumps are programmed by the registered nurse or pharmacist. Be familiar with categories of analgesic medications and be able to identify which category a medication belongs to if given one. For example, what type of medication is celecoxib? So we can find different categories and examples of these drugs on page 615 in table 31.2. Celecoxib is a COX-2 inhibitor. It blocks the COX-2 enzyme. This can play a role in arthritis pain. Another important category of analgesic medications to pay attention to would, of course, be our non-opioid analgesics, which include our NSAIDs. So be familiar with some of the examples that they list on this page, including ibuprofen, naproxen, and indomethacin. How is a PCA pump beneficial? We can find this information on page 617. PCA has been proven to greatly reduce patient anxiety about pain by putting the patient in control, and most patients will actually use less rather than more pain medication. What signs and symptoms would indicate a fentanyl patch overdose? What should be done if these symptoms are identified in a patient wearing a fentanyl patch? We can find this information on page 616 in the red box safety alert, fentanyl patch overdose. Signs and symptoms of fentanyl overdose are shallow respirations, extreme sleepiness, inability to think, walk, or talk normally, feelings of faintness, dizziness, or confusion. If any of these symptoms occur, remove the patch and clean the skin. Call the primary care doctor immediately. What are possible side effects of epidural analgesia? We can find this information on page 618. Possible side effects from the opioid component of the infusion include respiratory depression, pruritus, nausea, vomiting, constipation, urinary retention, low pulse rate, and hypotension. Because of rare but potentially dangerous side effects, particularly respiratory depression, patients receiving epidural analgesia are monitored closely. This often will include being placed on an apnea monitor and a pulse oximeter for the first 12 hours. When changing the dressing on an epidural catheter, what techniques or steps should the nurse follow when cleaning the site? So for this information, we're going to look on page 619, steps 31.1, monitoring an epidural catheter and changing the dressing. Pay attention to numbers 8, 9, and 10. Perform hand hygiene. Open the sterile dressings and prepare the sterile field. Then don your sterile gloves. Using aseptic technique, cleanse the site with alcohol ×3, using a circular motion, starting in the center and working outward. Repeat the cleansing with a povidone, iodine, or betadine solution ×3. Allow the solution to air dry. What are indications that a patient is in stage 3 of NREM sleep? We're going to look on page 620 for this. As stage 3 begins, the person enters a period called delta sleep or slow wave sleep. This is named for the high voltage slow brain waves that occur. Respirations and heart rate will slow in this stage, and the body becomes immobile. This deep sleep stage lasts 20 to 40 minutes, and dreaming is common. Stage 3 sleep is followed by the deepest stage of sleep, which is stage 4. During this stage, it is difficult to arouse the sleeping person, and this stage will last approximately 30 minutes. How can exercise contribute to a better sleep? When should the patient be advised to exercise? You can find this information on page 621. Regular exercise can help a person sleep, but exercising too close to bedtime can be overstimulating and keep a person awake. Taking a nap late in the day can also disrupt nighttime sleep and should be avoided if an individual suffers from insomnia. Instead, encourage exercise in the mornings for a restful sleep at night. Page 621. Define sleep apnea. We can also find that on page 621. Sleep apnea is a condition in which the person stops breathing for brief periods during sleep. What is an intervention that the nurse can suggest to the hospitalized patient who has difficulty sleeping at night? We can look at the clinical cues on page 621 for this in the purple box. If a patient complains of trouble sleeping, ask about any beverages that are consumed after 3 p.m. Many drinks contain caffeine, including many carbonated beverages, and it's important to check ingredient labels. Environmental factors, such as a room that is too hot or too cold, is too noisy, or has ambient light, will also affect sleep. Patients in the hospital can have increased interruptions of their regular sleep pattern because of hospital routines that cause noise or require lights. Because of this, they'll need to be awakened for medications or treatment. How long should sedatives and hypnotics be used to induce sleep? We can find this information on page 623. Medications such as sedatives and hypnotics are sometimes prescribed to promote sleep. These should only be used for short-term relief. And just going back to the intervention that a nurse can suggest, so those are some of the factors that cause difficulty sleeping while in the hospital. An intervention that can help with that is on page 623 in the bolded text. Many patients will sleep better if they have a favorite pillow or blanket from home, so we can suggest that they have a friend or family member bring them in one. Chapter 32, Complementary Health Approaches. What is an example of complementary therapy? We can find this information on page 627. Yoga is a great example of a very common complementary therapy. Yoga is a word derived from the Sanskrit meaning union. It's a spiritual practice that combines exercise, controlled breathing, posture, and mental focus to bring about positive effects on the body and mind. Yoga therapy is a great suggestion for the patient who wants to exercise but dislikes physical activity. What is an infection risk associated with acupuncture? We can also find this on page 627 in the Cusin Considerations orange safety box. It's important that only sterile needles be used for acupuncture because of the danger of infection and transmission of the human immunodeficiency virus, HIV, or hepatitis. What does Ayurveda medicine use to treat patients? I'm going to find this answer on page 631. Ayurveda uses the combination of herbs, minerals, purgatives, massage, meditation, and special diets. What should a nurse do if the patient tells the nurse he wants a traditional medicine man to come provide ritual treatment to him in the hospital? We always want to make all efforts to incorporate a patient's beliefs or desires into the treatment plan, and whenever there's any question about safety, call the doctor. And that information is on page 632. What supernatural component does the curandero treat? We can also find this on page 632. The curandero also treats the supernatural components of susto, fear, that is thought to cause the soul to separate from the body, resulting in illness. Mal de ojo is the evil eye. This is generally thought to affect children and causes fever, irritability, headache, and weeping. Empacho is a gastrointestinal disorder, thought to be caused by a blockage in the stomach or intestine. Practitioners are believed to have a don, or a God-given talent for specific healing, and will usually specialize in treating those areas of illness related to their don. How does meditation differ from imagery? So we can find this information on page 628. So imagery uses a visual stimulus to produce a particular physiologic change that can decrease stress or promote healing. Meditation involves focusing the attention on a single repetitive stimulus. It decreases awareness of all other stimuli. This will alter the consciousness and can bring a beneficial mind and body response. Meditation will induce a restful state and lower heart and respiratory rates. It can also reduce anxiety and depression. It has been helpful for people with asthma, hypertension, diabetes, chronic pain, and other disorders such as sleep disturbances. Meditation can also improve productivity and mood and reduce any irritability. What type of complementary therapy could the nurse suggest for a patient who is trying to quit smoking? Hypnotherapy on page 629 is a great therapy that has had some moderate success in helping people quit smoking or lose weight. It can be used to alter behavior, retrieve memories, and induce anesthesia. Which patients have been shown to benefit from meditation? So I kind of said that already, but it's going to be helpful for people with asthma, hypertension, diabetes, chronic pain, and other disorders such as sleep disturbances. How does biofeedback work? We can also find that information on page 628. Biofeedback is a technique that trains the patient to lessen symptoms by learning to control particular internal physiologic processes that normally occur involuntarily, such as heart rate or blood pressure. The internal activity is measured with electrodes and shown either visually on a screen or as a sound, giving the patient and the practitioner feedback about the internal workings of the body. The person with practice can then use this information to gain control over their involuntary activity. What could a nurse suggest to a patient who wants to start exercising but does not like intense physical therapy? Yoga is a great suggestion for a patient who wants to exercise but dislikes physical therapy. Chiropractic is another example of a complementary health therapy. And we'll get to that one later on down the list. What is an important cultural factor to consider when using humor to relieve a patient's pain? So for this, we're going to look on page 629 in the blue cultural considerations box. Nurses should be cautious about using humor because some humor can be considered disrespectful. It's important to understand how humor is viewed within the patient's culture before trying to be funny. Does the doctor need to know about herbal supplements that a patient is on at home? What should the nurse do if the patient tells the nurse that they're taking an herbal supplement that is not recorded in their medication list? So yes, feel that it's pretty obvious that they absolutely do need to know. And we can see that in the bolded text on page 632. It is vital for healthcare providers to know whether patients are taking over-the-counter herbal or homeopathic substances, because these can interact with prescription medications, even leading to organ transplant rejection. It would be important to question the patient about the use of complementary health therapy in a non-judgmental manner. It is not your place to encourage or discourage the patient's use of CHAs. Only guide the patient on where to find information about the approach and how to choose a practitioner. The patient should find out how many treatments will be required, the cost of treatment, and the possible benefits. Strongly encourage a pre-transplant patient to self-educate and discuss any herbal or natural products with their primary care doctor and pharmacist prior to consuming them. See the clinical cues on page 632. Patients often do not discuss their use of complementary health approaches with their primary care providers. Some think that because what they are doing or taking is natural, that it will not interfere with their prescribed medicine. Others are afraid that their primary care provider will disapprove and insist that they stop using their CHA or use a prescription medication instead of their supplements and herbs. It's important for the nurse to assist patients in understanding why it's so important for the primary care doctor to know what supplements and complementary treatments that the patient is using. Page 632. How does chiropractic work? Flip back to the beginning of the chapter on page 627. Chiropractic uses manipulation of the spine for symptomatic relief and improved body functioning by bringing the spinal components of the back into correct alignment, thereby decreasing or eliminating pain. What is ephedra and why is it dangerous? What would you expect a patient's vital signs to look like if they were on this medication? We can find information about ephedra on page 631 in the Cusins Considerations Safety Box. Ephedra, or ma huang, once a common ingredient in weight loss preparations, is a cardiac stimulant that can cause a variety of adverse side effects, including death. The U.S. Food and Drug Administration has banned the sale of weight loss products that contain ephedra, and patients should be counseled to stay away from this herb. Well, it's a cardiac stimulant, so what would you expect their vitals to look like? Of course, we would expect their heart rate and their blood pressure to be very elevated. What is aromatherapy? Can this be used on everyone? Aromatherapy can be found on page 631. It's a therapy that uses uses oils from plants that are either absorbed through the skin during massage or inhaled. Can this be used on everyone? Well, it can be used on everyone, but we want to caution the asthmatic patient in using aromatherapy due to the risk of any possible allergic reaction to the oils. What is a safety risk associated with consuming ginkgo biloba? You can find this information on page 630 in table 32.1, commonly used herbs. Ginkgo biloba may increase the risk of bleeding, and consuming raw or roasted ginkgo seeds can be poisonous. What is a safety concern when a patient is taking St. John's wort? We can also find this on the same page and within the same table. St. John's wort can lead to serious, sometimes life-threatening interactions with herbs, supplements, over-the-counter drugs, or prescription drugs. It can interact with oral contraceptives, digoxin, warfarin, and other medications. It can lead to increased side effects when taken with other antidepressants.